Hello, I'm Ed Ehlinger, a former show from Minnesota. And this morning at ASTHO's annual meeting, I was asked to just say a few words about what it was like to be a show and what I learned and what advice I could give to shows. And I know some of you were not able to be there, so I thought I'd kind of repeat a little bit of what I gave to the shows at the annual meeting. First of all, being a show is a once-in-a-lifetime experience. For most people, there are some who get that double run at being a show, but for most, it's a once-in-a-lifetime experience. And what a great experience it is. You get to be in places and situations that you never thought you would be in, like rooms at not only your state capitol, but sometimes at rooms at the U.S. Capitol, sometimes at the White House or the Executive Office Building. Sometimes you're in nuclear power plants or in emergency operations centers in the midst of a disaster, or in preparation for a Super Bowl, which for people in Minnesota is always a disaster because the Vikings have not done very well in Super Bowls. You're in places where you're creating multi-million-dollar budgets and you're making major policy decisions. And sometimes you're in the news, sometimes not so exciting news and sometimes difficult news, or sometimes, in my case, I was on the dais at the National Press Club. Whoever thought I would be able to be in that kind of situation? And then you get to be in places where there are lots of influential people. You also get to meet those people. I've met kings and queens and even a musical prince. Coming from Minnesota, you'd expect that, but you probably may run into a prince. I've talked to ministers of health from multiple nations. I've been ambassadors, elected official, history makers, Nobel Prize winners, and certainly people in my state and throughout the country with stories, tragic stories and triumphal stories. And you get to meet colleagues like other shows, that you now have colleagues and friends throughout the country and throughout the territories that'll last a lifetime. So savor the experience as best you can. Once in a lifetime, savor it, savor it. But I have three things that I just want to leave with each of the new shows. That you need to have voice, vision, and valor. Now, the voice comes from the fact that while public health may not be the biggest agency in state government and may not have the biggest budget, you're an important person in your state, and your voice really matters. You have a bully pulpit like you will never have again, and probably you've never had before. So use that bully pulpit as best you can, because you're going to be a powerful voice in your community. And so that voice has to find ways to really focus on data, the voice of values and principles, the voice of stories, and certainly the voice of your position. And so you want to amplify that voice as much as possible. Use it whenever you can. But also you want to use your voice to actually enhance the voice of people in the community. Their voice is also very powerful, particularly in complementary to yours. And also focus on county commissioners. In their voice in your state are really, really important. I found them to be one of the most powerful public health allies in the state. So that's the voice piece. Second is vision. You really have to have a vision about where you want to go, and a vision that is understandable to people in your state so that they can really understand where you're going, where your agency is trying to go, but also a vision that is understandable to people in your agency. Everybody in your agency, in your department, really needs to feel how they connect with that vision, how they're part of it. That way they'll have buy-in and they'll be able to support you. If your vision is too narrow, that doesn't include people in epidemiology or environmental health or newborn screening or the public health lab, they're not going to feel part of the agency. You need to have a vision. I would hope you could have a vision that includes everybody. So that vision is really, really important. Lastly is valor. I needed a third V, and I mean courageous leadership. Courageous to be able to speak truth about what creates health in your community. You have to stand up for the public good. Not all elected officials have that. They're in more of a win-lose kind of game. Even your governor is really one looking at policy issues from a different lens. You need to stay focused on what is really good for your state, for the public good, for public health, for prevention, for sound science, and for equity. And I think you have to remember, or at least I would encourage you to remember, that although you were asked to be commissioner or show by the governor, you really work for the people in the state, but mostly you work for the staff of the agency. Those are the public health professionals that get all of the work done in your community, in your state. They are the ones who day after day administration after administration are the public health workers. And you need to protect them, you need to support them, you need to be able to be their champion. So that is really where I think you need to focus a lot of your energy. So I ended up this statement with a quotation from William Faulkner, whose birthday it was today, which is the 25th of September. He said, "Never be afraid to raise your voice for honesty and truth and compassion against injustice and lying and greed. If people all over the world would do this, it would change the earth." So with your vision, with your valor and your voice, speak for public health, speak for health equity, speak for community development, speak for community resilience, speak for making your state one of the healthiest in the country. Thank you.